Most dentists look at their offices from the outside in, and they want to build their practices from the outside in. They'll spend all kinds of money in all kinds of marketing scams and advertising where they shouldn't be advertising and stuff that's really not effective. Never evaluated, but they think that as long as I can get a whole lot of different patients into my office, doesn't make a difference. Let me get as many new patients as I can. It's almost like a shotgun approach. I don't care what the new patient is like. I don't care who the new patient is. Let me get as much of them into my office as I can. Then my office will be great. Nothing could be further from the truth, and I've seen this for years already, where dentists have just lost tons of money advertising and advertising, trying to get patients in, but what happens? They may not have a great staff. No one knows how to answer the phone at the front desk. And what you're doing actually is you're sending more patients out the door than you are getting patients in the door. You need to take the approach of building your practice from the inside out. And that is how you will really build a great practice, because you need a solid core in your office. What's the solid core in your office? A great dental team. That's the solid core in your office. A great dental team that knows how to handle patients, knows how to talk to patients, knows how to present cases to patients, knows how to answer the phone so that when a new patient calls, they make them comfortable, they assure them that they are in the right place, that the dentist is a great dentist. All those things work together, and that way you don't need 100 new patients a month. I would even say you couldn't handle 100 new patients a month. Most of you, especially if you're a solo office, can handle that kind of volume. If you had 100 new patients the next month, I would tell you it'd probably be one of the worst months you would ever have. Why is that? The reason being is all you'd be doing is new patient exams. You would be very frustrated. You'd have very little production. You'd be trying to do these treatment plans for all these patients. You need a good 20 to 30 new patients a month, but you need a great dental team that knows how to handle these people and also motivate them to treatment. That's how you build a great office. It's from the inside out, not from the outside in. Building a great dental team is what can make or break your office over the long term. How do you do that? There are lots of resources out there. Certainly Sally McKenzie, a lot of you know them, Sally McKenzie Group. They've got a lot of good resources for you. I've put together a 10 CD set of building the best dental team. By all means, go there, see if you like it, but it covers all kinds of different things. I'll just give you one little snippet on that. Go ahead and hire for attitude and train for skill. Right? I mean, that is basically, that is a basic piece of knowledge that anybody in the hiring world knows about. You look at lots of other industries. Why is that? Because I can't train attitude. I can guarantee you one thing. If you've got A players out there, then that's great. But if you've got a C or a D player in your office, they are bringing down all the A players. I know you keep imagining or dreaming that your A players are finally going to raise the C player. Believe me, it doesn't happen. Okay, so you need to hire for attitude. I can train anybody to do anything, but I cannot train attitude. Go to my webpage, go check out other resources, but I don't care how you do it, but go ahead and build a great dental team. You need to build your practice from the inside out. Check out my website for more resources. We'll see you next month right here.